Hello and welcome to our webinar series, Candid Conversations on Health. Throughout the year, we will tackle a variety of topics related to our health and wellness. The focus of today's webinar is breast cancer awareness. My name is Ayana Usri, and I am the support coordinator for the Louisiana Department of Health's Bureau of Community Partnerships and Health Equity, BCPHE. The Bureau of Community Partnerships and Health Equity is devoted to increasing the citizens of Louisiana's knowledge about what affects our health, especially for those in particularly vulnerable communities and populations. This devotion is rooted in raising awareness through webinars like today's and partnering with stakeholders in the community to move forward toward a healthier Louisiana. At this time, it is my honor to introduce Ms. Jarrelda Davis from the Louisiana Primary Care Association, who will share a few welcoming words. Ms. Davis.
Thank you. Welcome to Candid Conversations on Health, Breast Cancer or Wellness. Cancer, cancer, cancer. Whether you are a survivor, a caretaker, or a provider, everyone has been touched by this horrible disease. In 2010, at the ripe age of 40, I was diagnosed with stage 1 breast cancer. Today, 12 years later, I am a survivor. However, it was not always so easy for me to say this out loud. Immediately after my last radiation treatment, which came after I completed a very long chemo regimen, I felt completely lost. I struggled with what if it returns. I wondered, would my hair grow back? Or would I have a bald head and no eyebrows for the rest of my life? I struggled with guilt, knowing that so many others had lost a fight while I was still very much alive. And most importantly, I did not know how to live healthy anymore. However, gradually and with the best support system ever, my post-cancer life became my new normal. And I realized, as Eleanor Roosevelt said, you must do the thing you think you cannot do. Survive. Today's speakers are going to provide information on breast cancer. Let's prepare to learn new techniques for providing quality care to those who need it most, the resources available, and how to survive. Thank you.
Thank you so much, Ms. Davis, for that wonderful welcome. All right, so let's get started. So here's an overview of our event today. We'll start with our intro and welcome, which we're doing now. We'll go over our facts as it relates to breast cancer awareness. Then we'll have our panel discussion followed by some key takeaways. So those breast cancer 4 facts. So the objective of this webinar today is to increase awareness related to breast cancer. So first, breast cancer is the most commonly diagnosed cancer among American women. However, this form of cancer can affect men as well. Next, get up-to-date and accurate information from credible sources related to breast cancer, like the Louisiana Department of Health, Centers for Disease Control and Prevention, the American Cancer Society, and more. 3, prevention efforts. Prevention efforts involve understanding what breast cancer is, the factors associated with increased risk, and the various screening or treatment options available to you. And last but not least, we know that early detection saves lives. These 4 facts are ones you will hear throughout the webinar. I want to stress the importance of getting information from trustworthy sources. So if you're going to share information related to breast cancer with loved ones or within your communities, please only use information coming from websites like the Louisiana Department of Health, the CDC, and the like, as I've mentioned. We will provide you with a 1-pager via email after this session to share breast cancer awareness information. Sharing accurate information can help save lives. And now it is my pleasure to introduce Director of the Bureau of Community Partnerships and Health Equity, Devondra Brown.
Thank you, Ms. Usri, and thank you all for joining tonight's Candid Conversations on Health, Breast Cancer Awareness webinar. Before I turn the session over to our event moderator, I want to thank each and every one of you for joining today's conversation. I hope that you find today's discussion informative and helpful. But before we start, I'd like to share a message from Medicaid for people with Medicaid insurance. If your medical insurance coverage is from Medicaid, then you must make sure that your information is up to date. This includes your address. If you do not update your information, you may miss important letters from Medicaid and you could lose your coverage. Make sure that all of your information is up to date by visiting the self-service portal at www.lgh.la.gov/my-Medicaid, or you can call 1-888-342-6207. That information will be there with you after this webinar. Without further ado, today's moderator is Ms. Gerelda Davis. Gerelda Davis received her Bachelor's of Arts degree in English Literature from Louisiana State University and her master's degree in Business Administration with a concentration in Healthcare Management from the University of Phoenix. She worked for Louisiana State government for 22 years, and we thank you for that service. Serving in numerous positions where she worked to identify and pursue opportunities, access, and funding for primary care and rural health initiatives. Currently, she serves as the Executive Director.
All right, no problem. We may have lost Miss Brown, but that's okay. I'll pick up for her. Let's see. So currently she serves as the Executive Director of Louisiana Primary Care Association, which promotes healthcare access for all and elimination of health disparities while ensuring that community health centers remain viable providers of primary health care throughout the state and resolute partners in comprehensive healthcare delivery systems. All right. So let me
Thank you so much,
and-
Ayana, Ms. Usuri, for finishing that. That's what it takes to have a wonderful team. We all work together. So let's get ready and have a discussion. Please, Ms. Davis, you have the floor.
Thank you, Mrs. Brown and Ms. Usuri, for starting today's event. For each of you, community members and stakeholders who took the time out of your busy schedules to attend this important discussion, thank you. In this webinar, our hope is that what you hear, you find useful, empowering, and encouraging. We want people to leave the conversation empowered with the knowledge to know the signs, symptoms, and risk factors of breast cancer and what treatment options may be available for them. We have trusted gatekeepers from around the state who will lead and be a part of this discussion. Before we go any further, let me do a brief introduction of our panelists. Dr. Sean McKinney is a native of New Orleans, Louisiana, currently serves as the Director of Breast Services at University Medical Center, New Orleans. She is Professor of Clinical Surgery at LSU Health Science Center, New Orleans. After completing her high school education in New Orleans at Ursuline Academy, she graduated magna cum laude with a BS in chemistry, pre-medicine, from Xavier University of Louisiana. She attended medical school at Morehouse School of Medicine in Atlanta, Georgia, and then continued there as a surgical resident, completing that program in 2002. It was during this residency that she realized her love for treating breast cancer patients and entered a surgical breast fellowship at Baylor University in Dallas, Texas in 2003. After fellowship, she spent 10 years at Marshall University School of Medicine in Huntington, West Virginia, as co-director of the breast program at the Joan C. Edwards Cancer Center. There, she established and accredited their breast program, drawing patients from the tri-state area for state-of-the-art breast cancer treatment. Next, we have Dr. Mindy Williams-Bowie. She is a breast surgical oncologist who specializes in breast cancer surgeries. She practices at Women's Breast Specialists at Women's Hospital in Baton Rouge, Louisiana. She is board certified by the American Board of Surgery and is a fellow of the American College of Surgeons. Dr. Bowie attended Louisiana State University, where she received a Bachelor of Science in Microbiology and Master of Science degree. Upon graduation, she continued at Louisiana State University Health Sciences Center, where she attended medical school in 2004 and completed her general surgery residency in 2009. She then completed a breast surgical oncology fellowship at Moffitt Cancer Center in Tampa, Florida. She practiced in South Florida for several years prior to returning to Louisiana. She currently chairs the American College of Surgeons Commission on Cancer, the Breast Program Leadership Committee, and the Breast Multidisciplinary Care Team at Women's Hospital. She is Chief of Surgery at Women's Hospital. She's an active member of the Society of Surgical Oncology and the American Society of Breast Surgeons. Dr. Bowie is certified in hidden scar breast surgery, and her expertise is in nipple-sparing mastectomies and oncoplastic breast surgery. Dr. Bowie is active in breast cancer research and prevention and has been published in several breast cancer journals. She is married and has 2 children. Denise Cox. She joined the Louisiana Breast and Cervical Health Program as a patient navigator in 2018. She is responsible for patient navigation at University Medical Center, ensuring that underserved women are screened for breast and cervical services through the program. Ms. Cox began her public health professional career at LSU Stanley C. Scott Cancer, where she began as an intern in the year 2000-2001. Following graduation from Dillard University, where she received her Bachelor of Science degree in public health, she was offered a data entry clerk position, which in turn resulted in her becoming one of the youngest program coordinators for the Partners in Health program, overseeing 20+ employees and the day-to-day functions of their breast and cervical outreach program. After Hurricane Katrina, Partners in Health program ended, but as luck would have it, Denise was able to return to her hometown of Edgar, Louisiana, where she became coordinator for the Families in Need of Services program for at-risk youth in St. John the Baptist Parish judicial system. She was instrumental in establishing various local resources to provide to families so they would have timely access to services depending on the need of the child. However, Denise's goal was to always return back to her roots at LSU Health Sciences Center, which is where her love for helping the community began. She enjoys engaging, educating, and navigating women throughout Louisiana about the importance of breast and cervical health, not only in October, but year-round. And then we have Dr. Jasmine Eugene. She's a native of New Orleans. She completed her undergraduate degree in music with a minor in chemistry at Xavier University of Louisiana. She went on to pursue her pharmacy degree at Xavier University of Louisiana College of Pharmacy, where she participated in organizations, organized community service events, won various awards, and graduated with honors. Dr. Eugene completed her PGY1 pharmacy residency at Our Lady of the Lake Regional Medical Center and her PGY2 in oncology at Ochsner Medical Center in New Orleans, Louisiana. During residency, Dr. Eugene conducted research and educated the oncology physicians, nurses, and students. Dr. Eugene is currently a clinical faculty member of Xavier University of Louisiana College of Pharmacy, a board-certified oncology pharmacist. Some of her interests include breast cancer, lung cancer, hematologic malignancies. In her spare time, Dr. Eugene likes to eat New Orleans cuisine and spend time with her family and her dogs, Ben and Jerry. These are our panelists. They are going to help us have a brief but deeper discussion. As we start this panel discussion, it is important that we continue to remain vigilant in the fight against breast cancer and pursuing a healthier Louisiana. So let's start the panel discussion. This discussion will be factual, based in science, and it will be addressing questions you may have in regard to breast cancer. Let me be the first to say, as the moderator of this session, that people have a right to feel what they feel regarding their past and present experiences of racism, sexism, mistreatment, or injustice. We know these experiences play a part in people, populations, and communities' trust in the healthcare system. So let's get this panel discussion started. So my first question, and I'll start off with Dr. Sean McKinney. what is your profession and how is it related to breast cancer?
Well, thank you so much for the opportunity to be with you all this evening. Thank you, Ms. Davis, for the introduction. And I am a breast surgeon, so most of my interaction with patients involves giving the diagnosis of various breast conditions. A lot of them can be non-cancerous conditions that can also affect the breast, but unfortunately, I also have to give cancer diagnoses to women and then, or men, and then work with a multidisciplinary team in order to come up with the best plan for that patient. My role specifically is in the surgical management of that patient, but it is often a joint multidisciplinary approach for each patient that we use in order to individually treat their specific cancer.
Thank you. Dr. Bowie, what is your profession and how is it related to breast cancer?
I am a breast surgical oncologist. So like Dr. McKinney, I take care of women that have been diagnosed with breast cancer. I'm often the one that is diagnosing them. And as she mentioned, we do have our multidisciplinary team here where we have our breast surgical oncologist, radiation oncologist, medical oncologist, and support services all in one facility. So we present our patients at tumor board every week, and we come up with a plan as to how these patients need to be appropriately treated from a surgery standpoint, from a chemotherapy standpoint, from a radiation standpoint. I follow my breast cancer patients forever. So I tell them that from day one that I diagnosed them, that we're going to be friends a long time. So my job is to take care of these lovely women, and I am so honored to get to do it.
Thank you very much. Ms. Cox, same question. What is your profession and how is it related to breast cancer?
First of all, thanks for having me be a part of the panel. And I'm the patient navigator for the Louisiana Breast and Cervical Health Program. So my role is to help patients to navigate through UMC or any of our partner facilities within Louisiana or within the New Orleans area. So I pretty much will do anything within my power to remove any barriers for that patient as they navigate the healthcare system. And I encourage them and educate them on the importance of mammography screening, doing those clinical breast exams, so self-examinations. And we do a lot of outreach in like target populations in areas that are rarely screened or barely never screened. So we do a lot of work there to try to recruit those patients in for screening.
Thank you very much. And Dr. Eugene, same question. What is your profession and how is it related to breast cancer?
So I'm the clinical oncology pharmacist for Xavier, and my site is at UMC. So what I essentially do is help with the best recommendations in terms of chemotherapy agents or oral agents. I also help with monitoring and dosing, and depending on the patient's laboratory or vital signs, and just depending on the patient as a whole.
Thank you very much. And I will say from my point of view that this is the first time that I've heard, or as I got to know you all by reading your information, that such a thing as a oncologist pharmacist. So thank you for getting to know you on that one. And so I'm going to start off with Dr. McKinney. I think this is a great question for us to start off with. And it is, what is breast cancer? And are there different types of breast cancer?
So, any cancer anywhere kind of starts from a normal cell changing to an abnormal cell. And then that abnormal cell starts to grow in an abnormal way and starts to create what's called a tumor or more of the abnormal cells. So the kind of first step is that you have a normal cell that for some reason changes to an abnormal cell. And for most patients, especially I guess for breast cancer, we don't know the cause of an abnormal cell coming about. Some patients have genetic disorders that we can diagnose, and we can kind of pinpoint that could be the cause. But for a lot of patients, we don't know the initial cause. And there are different subtypes of breast cancer depending on where it originates in the breast. You have ducts that drain the breast going toward the nipple, and you have lobules, which are kind of the milk producing areas of the breast. And then there are other areas of the breast that have other different designations. But those two sites, the duct and the lobule, are the two most common sites that breast cancer can start in. And there are many other subtypes, but when most women say they have breast cancer, it usually is the ductal type. That's the most common type that's diagnosed.
Thank you. Ms. Cox, when should individuals consider getting screened for breast cancer?
Okay, well, it's recommended that they begin screening at the age of 40. Our program actually only screens patients or women ages 40 to 64. However, if we do have women that may contact us or we come into contact with, and they're under 40 and are experiencing any type of breast symptoms, such as nipple discharge, pain in the breast, lumps in the breast that they may feel during their self-breast examinations, we do assist those patients if they're under 40 as well.
Thank you. And I'll say, you know, from a personal perspective, because I had my mom's sister who was diagnosed earlier than myself, I actually insisted with my doctor that I get tested before I turned 40. So it was when I was 39 and they had a baseline. So when I turned 40 and had my next mammogram, they were able to compare, and that's when I was diagnosed. So thank you very much for that information. Dr. Bowie, what are some warning signs or symptoms of breast cancer?
So the most obvious sign that we see in women are they present with a mass in their breast, but sometimes it can be not quite so obvious. Sometimes just a subtle indentation in the skin that a woman will notice whenever they're looking at themselves in the mirror. Sometimes changes to the nipples, such as nipple flaking or nipple discharge, can also be a sign of breast cancer. Although I do want to mention the most common reason for a nipple discharge is not breast cancer. Some women can present with this diffuse erythema or redness of the breast. That can be associated with a more advanced breast cancer. But the majority of women that are diagnosed for breast cancers are fortunately diagnosed at an earlier stage because they received their mammogram that detected an abnormality in their breast before they could ever feel it.
Thank you very much. So important. Dr. Eugene, what are the risk factors associated with developing breast cancer, and what can be done to reduce these risks?
So, Ms. Davis, you kind of touched on it, having family history of breast cancer. So knowing your first degree relatives, so mother, I always think of mother, daughter, sister, right? Knowing if they've ever had breast cancer increases your risk. Also obesity. So making sure that you are maintaining a normal, healthy weight, eating healthy foods, and then also physical activity, right? But then also not smoking, decreasing your amount of drinking alcohol. I always say, they say less than 2, but I always say about 1 a day should be fine, but don't go more than 2. Another things you could think of is just, so I'm thinking in general, non-modifiable things you cannot change. Just being a woman increases your risk, right? Because essentially what we think of breast cancer, the very more common kind is estrogen receptors. So we are women, we have estrogen throughout our bodies, right? So of course, we've talked about obesity, but your fat tissue can also increase your risk because of it creates estrogen. Other things, again, oral contraceptives, estrogen-based contraceptives can increase your risk as well.
Thank you so very much. Ms. Cox, how important is transparency with your healthcare provider?
Oh, wow. That's actually a very key component, especially in the population that my program, our target area. I say that because it's very important to hold our medical providers accountable, because I believe that it leads to better patient outcomes for sure. So our patients that we see not we see, but that that we refer out to see our providers. We depend on that greatly.
Thank you. Dr. Bowie, what is a breast self-exam and how often should we check ourselves?
So a breast self-exam is something that I think is very important. I think all people should know how to do a breast exam, at least in some form or capacity. But whenever I'm examining a patient, I walk her through that exam and I tell her, hey, this is how I want you to do this at home, because the more often you do this, the more comfortable you're going to feel about it. I do recommend that a woman does a breast exam, a self-breast exam once a month. I always tell them once a day or once a week is too often, because if you do it too often, you're not going to notice that subtle change. So once a month, the best time would be the week, if the patient is having a normal menstrual cycle, the week after her menstrual cycle. I recommend the patient doing a breast exam sitting up or standing up, like in front of the bathroom mirror. And most of my ladies at that point say, well, I do mine in the shower. And I say, that's great, but do it before you turn on the water. So water, soap, it can actually, you'll slip past something and not notice it as easily as you will with dry skin. So I think dry skin is very important. Sitting up as well as lying down. So I tell my ladies, if you want to do it in the shower, that's great. Do it before you turn on the water, but also go and lie down for that physical exam as well. I do recommend that they start all the way up under their axilla or armpit, feeling what we call lymph nodes. Now, some ladies aren't going to be able to feel these. Some thinner women can, but they need to know how their body feels up under their armpit. And then moving in a clockwise, counterclockwise position throughout all of the breast tissue, making sure we go high all the way to the collarbone and cover all aspects of that breast tissue. Again, sitting up as well as lying down. The more often a woman does this routinely once a month, the more comfortable they're going to feel about it, the more they're going to know their breast, and the more likely they're going to know if something does change.
Thank you. I remember when I was first taught, I was taught to lay down, use 2 fingers and those types of things, but I still believe in, and it's very important that we use the proper techniques. As in one of the other programs that I work with, they're talking about proper techniques for blood pressure or taking your blood pressure. And I think it's also important for breast cancer. Dr. McKinney, are there variations of breast cancer that affect certain populations more than others, especially here in Louisiana?
Yes. So, unfortunately, we are seeing a specific type of breast cancer, which is coined triple negative breast cancer. That is a specific subtype of breast cancer that can be more aggressive. And we are seeing that more readily in our African American population. And those patients, unfortunately, can be younger as well. It contributes, to our increased mortality from the disease, especially when younger women are being diagnosed with this type of breast cancer. It really is more aggressive and usually is going to require chemotherapy in order to be a part of that patient's treatment plan. And there are multiple studies and research ongoing now that are trying to figure out exactly, what drugs, such as what Dr. Eugene is involved in, and what are the best combination of drugs to use in order to attack this aggressive cancer.
Thank you. And I'm going to go off script a little. I still want to say what Dr. McKinney in my next question, because knowing that and knowing how it falls in the African American community, how important is it genetic testing?
Genetic testing is really important because now the standard is that if you are diagnosed with a triple negative breast cancer, you should have genetic testing for any woman, any age, because we have seen an association with that subtype with having a positive genetic disorder. It not only helps with sometimes picking certain agents for that patient's cancer to be used in their chemotherapy regimen, but it also can give a lot of information to the rest of the family, because now you have, more information that the family can go on and hopefully either be candidates for, earlier screening, earlier surveillance, more advanced testing, and genetic testing themselves. So it really not only impacts that patient, but the patient's family.
Thank you so very much. Dr. Eugene, what are the various, and I'm going to say that and I've talked to others who've been diagnosed and had to go through the regimen and the treatment. And one of the first things, I guess, I didn't think it would hit me as much as it did. But when I started my first treatment, went home, went to work the next day, and I don't know how long it took, but just reaching up, my hair was very short, but I still had hair on my head, and it coming out in my hands. And that was the first time I cried, and it had nothing to do with vanity, and learned to live life with a bald head later on. But, it was something. And I had been warned that the types of medicines that I would be putting into my system would cause that. So what are the various treatment options once a breast cancer diagnosis is confirmed?
So kind of what Dr. McKinney alluded to, there are different types of breast cancer, and certain types of breast cancer require certain types of treatments. So I'll just briefly mention some of them. So I mentioned estrogen receptor positive or hormone receptor positive breast cancer. Those agents, of course, you may need to get chemo depending on your risk, depending on what stage you're diagnosed at. But you're going to probably receive, if you're going to receive chemo, you're going to receive cytotoxic chemotherapy. And same thing with triple negative breast cancer. And even if you have HER2, depending on it, you can also receive it too. Cytotoxic chemotherapy targets rapidly dividing cells. So I always say your hair, your mouth, you might have some mouth sores every now and then, you might have a little bit of diarrhea, nausea and vomiting can be another thing. And then also I tell my patients decrease in infection fighting cells. That is something that patients may experience as well. And you alluded to the hair, the chemotherapy that we generally give patients who have breast cancer are cytotoxic, and they will cause hair loss. So I always inform my patients about that. Now, you kind of talked about it when you were talking about it earlier. Now, it's not permanent, but I always tell my patients it's something that you do need to be aware that can happen or that will happen. It will grow back, but it might grow back different in terms of texture, color. So just be careful, be aware that this may happen.
I agree.
Yeah,
But
I'm sorry, you can go.
no, I was just saying I agree with you. I'm so sorry.
Yeah, no, it's fine. If you have HER2 positive breast cancer, we give this drug called trastuzumab or Herceptin. This agent did wonders for those patients who had HER2 positive breast cancer. The only downfall is that this agent can cause heart problems or heart failure, and we're giving you another medication that can potentially cause that as well. So something that I'm constantly monitoring is your heart function. So I always tell my patients the signs and symptoms of heart failure. If they experience it, I always look at their cardiac monitoring, because it's such an important thing to stay on top of.
Thank you so very much. Dr. Bowie, should individuals get screened only? And I know you've answered this, but it's always good to reinforce. Should individuals get screened only if they feel a lump or see a noticeable difference in their breast? And when should individuals seek advice related to breast cancer?
So first of all, as we alluded to earlier, women at the age of 40 should start yearly screening mammograms. There are some subset of women that may need to start at an earlier age, depending on their family history and their risk factors. But by all means, I would certainly not recommend a woman only getting screened if she develops a mass. Obviously, she needs to get screened if she develops a mass. And I always want to mention that if a woman feels a mass in their breast and they get a mammogram, and the mammogram says it is normal or that there's no suspicious findings, that lady, that patient needs to seek further evaluation, whether it be an ultrasound, whether it be an MRI. Oftentimes ultrasound is the second choice. But if you feel something in your breast and you do your due diligence and you get your mammogram, but it is now read as normal, do not stop there. You need to seek further care, further evaluation, and possible further testing.
And Dr. Vui, I want to follow up that response with, why is there a cutoff of age 64?
Well, it's not. There's certain guidelines that do recommend 64, whether you're going with the U.S. Preventative Task Force, whether you're going with the American College of Radiology, the American College of Obstetrics and Gynecology, the American Association of Breast Cancer. It all depends on what criteria you are following. My rule of thumb is that I recommend an individual to still have a yearly mammogram if she is expected to live another 10 years. And so that may not apply to a 52-year-old, but yet that may indeed apply to a 92-year-old. So I don't like that cookbook recipe of let's just cut it off at a certain age. I always recommend if that woman is healthy and she's doing well and she's expected to be here another 10 years, she should still be having her yearly mammogram.
Thank you so very much. Ms. Cox, what options are currently available for the uninsured who would like to be screened for breast cancer?
Well, our program, we offer clinical services such as clinical breast examinations, of course, mammography screening, cervical screening, and we actually have 11 sites throughout Louisiana. We're located in 8 different parishes throughout Louisiana, and we provide navigational services as well, which is my role at UMC. So I pretty much help the patients to navigate, as I mentioned before, the process of scheduling an appointment, knowing where to go, speaking to them, removing any barriers and stuff like that. But that's the basis of what we cover.
Thank you.
And I do want to mention too, that if a patient is screened through our program and they are unfortunately diagnosed with breast cancer, we do assist those patients with applying for what's called BCC Medicaid. I know Dr. McKinney's staff, her support staff is really good at doing that with our patients at UMC, and that covers the cost of their treatment.
Thank you.
But only if they're screened through our program.
Thank you. So Dr. McKinney, what role does health equity play in breast cancer awareness? And why is equity important when discussing risk factors and treatment options?
Well, that's a huge question. And, we see the inadequacies that exist among patients, and that leads to what we experience as disparities. Why does one patient's cancer diagnosed at a stage 1, and then you have someone else who comes in at a stage 3? Kind of not knowing the immense barriers that are present, the inequity that just exists as a result of either where they live. It could be location, it could be access, transportation issues. When we talk about risk factors and we tell people to eat healthy and exercise, that could be their neighborhood. There are inequities there. Do you have a safe place to exercise? Do you have, where are you in a food desert? Do you have food that that you can afford? So, when we talk about all of these things that we would like patients to do, you really have to do a deep dive into, can they do them? Is this feasible for them to do if we really want to start to make things equal and really try to decrease the disparities that exist? I mean, that can make all the difference between a patient coming in to be evaluated or not.
Thank you so very much. Dr. Eugene, go ahead.
I'm sorry, I wanted to also kind of piggyback off of Dr. McKinney and just kind of say that the Louisiana Breast and Cervical Health Program is definitely, so everything what Dr. McKinney said is 100% true, but we have to try to combat that in whatever way we can. And I really want to say that the Louisiana Breast and Cervical Health Program is definitely doing that. It's something that I think all states probably have, but I want to say that when I was looking into more of statistics in terms of like cervical and mammograms and different things like that, Louisiana was doing pretty well compared to the national average. And I really want to think, and I think it's because of these programs that we have.
Thank you so very much. And I agree with you. And continuing with you, Dr. Eugene, is it beneficial to catch breast cancer early?
Oh, definitely. A good way to think about it is like Dr. McKinney was saying, stage 1 versus stage 3. Stage 1, depending on when they catch it, the size of the tumor, you may or may not need chemotherapy, or depending on the receptors, you may or may not need chemotherapy. The later you catch it, the more likely you are to need chemotherapy, the more likely it is to spread. So we want to catch it early, and this is the importance of screening and screening at those appropriate ages and frequencies, essentially, because the earlier you catch it, the less likely you are to be metastatic, which means it spreads to different organs, and the better outcomes you may have in terms of course, morbidity, mortality, and different things of that sort.
Thank you so very much. Ms. Cox, going back to the previous comment by Dr. Eugene, what is the Louisiana Breast and Cervical Health Program?
It's a great program, of course, but what our program is, well, LBCHP is the short acronym that we use to describe it, to describe our program. And it was pretty much established because there was such a high mortality rate, but a low incidence rate of both breast and cervical cancer. So Congress and the CDC, they did some great work, and now all 50 states have programs like this one. So pretty much what we do is we offer low-income, uninsured, underinsured women timely access to breast and cervical screening services and diagnostic services. So as Dr. Eugene mentioned, we have done a phenomenal job, I believe, in increasing the screening rates in Louisiana and decreasing the mortality rate. So it's definitely beneficial and needed.
I agree with you, and I do know that when Medicaid was expanded in the state, the number of uninsured women decreased, but that did not mean that there weren't females and males, let me not forget that may need the services out there. So Dr. Bui, are there disparities in breast cancer, deaths, diagnosis, screening rates, et cetera?
Unfortunately, there are. There are social, economic, and behavioral disparities. Let's just start, first of all, with an African-American woman is less likely to breastfeed. And we know breastfeeding can actually decrease your risk for development of breast cancer. We know that when an African-American woman is diagnosed with breast cancer, it tends to be at a later stage or more advanced. We know that when an African-American woman is diagnosed with breast cancer, there tends to be a more delay in starting her cancer care. And there's also more of a chance that the recommended treatment plan is not going to be followed because of these social disparities. We know that just the age-adjusted breast cancer mortality is about 40% higher in African-American women versus non-Hispanic white women, despite there being a lower incidence of breast cancer in African-American women. And as of 2020, breast cancer now became the #1 cause of cancer-related death in African-American women. Prior to 2020, it used to be lung cancer. Now it's breast cancer. And a lot of this does have to do with these social disparities. We know that I believe breast probably surpassed lung, and that less people are smoking now than in the 60s and 70s. But we still have all of these economic, social, behavioral barriers that are still front and foremost, that we on a daily basis try to work through, whether it be with our nurse navigators, whether it be with our ancillary staff, whether it be with transportation support services. We have a lot of good support services through ACS and other support services in Louisiana that help to get these women and men to where they need to be for their cancer treatment. But there is no doubt in mind that we still have a long way to go. We're doing good. We need to do better.
Thank you so very much. And I want to thank each of you for what you do for the patients of Louisiana. But I will say that I think patients also need to be very proactive in their care and demand what they need to. So I'll say, and I'll use myself as an example, when I was 39 and I had one doctor, and it was a male doctor, and I was insistent on getting that mammogram. He's like, what do you need that for? You're just 39 years old. And so immediately, I guess one of the reasons, guys, I work in healthcare, I said, okay, I need a new doctor. Changed doctors, female doctor, and she said, yeah, you can get it, your insurance. And it really wasn't a matter of insurance, because I said, I'll pay for it anyway, because I was just insistent. Thank goodness I had that. They had that baseline for that next year. But I do believe that also plays into what has happened in reference to equity, in reference to cancer rates and those types of things. Lots of patients, whatever race they are, they're not as astute and they're not as proactive as they need to be in asking and being insistent. Because yeah, I'm going to respect you because you're a doctor, you've gone to medical school and those types of things, but I also know what I feel in my body, and I also know those things that you may not know. And so I just think we need to be very proactive. And in saying that, and in conjunction to what Dr. Bowie said, Dr. McKinney, what are the social and drivers or determinants? But I like to use drivers because I don't think we're determined, because you're going to be that no matter what. What are the social drivers of health, and how do they affect our health? Breast cancer rates, for instance.
Well, I'll tell you, some things that can lead to a delay in diagnosis, or other things that may not be so well apparent, but it can be your own spiritual and faith that can contribute to that. And a lot of times, I have found that in just spending the time and talking to patients, they sometimes don't come in because they believe that, something spiritual, or they were told to wait, or that God would fix it. And you kind of have to work through, some of that and come to a bit of a middle ground with them. So some of that can be an unknown delay in diagnosis. Other things, transportation is huge. And especially if you have a working woman taking off of work, rearranging. We all are women who work. I mean, just think if you just have a child at home and you have to adjust your schedule, how absolutely disruptive that is when your child gets sick. So, these women, if they're working, their schedules, for all of the appointments and the follow-ups and your chemotherapy and all of these things, that's so many days off of work. And not everybody's employer is, very gracious and forgiving and compassionate. So they have that stress to deal with in trying to make these appointments. So, it's so many things that, cover even a patient getting in, but then even once they're diagnosed, there's still barriers as to them, being able to go through the treatment plan like you would want them to. And, it's just, for us as a team to be able to work with that patient and try and knock down, what we can and be flexible with them. But the socio and economic barriers start in the beginning, but they continue all the way throughout treatment.
Thank you. One more question for you, Dr. McKinney. And I know we've mentioned, and I know Dr. Bowie has mentioned something, I know Ms. Cox has mentioned, and I think also Dr. Eugene, but what are the different screening options for breast cancer? And how important is screening for breast cancer?
So mammogram is the standard, and it still is the standard, especially for women over 40. That is, I see some women trying to replace replace the mammogram with something else they feel maybe a little bit less painful, yes. Like, oh, well, I'll just get an ultrasound. I don't really want the mammogram. The problem with the ultrasound is that it cannot pick up, one of the early stages of breast cancer that often present by mammogram, by these little calcifications that are seen on your mammogram. You won't see that by ultrasound. So I always tell women when they come in, oh, I don't want to sit, oh, please, let's have a talk. I need to tell you why this is so important. This is really, really important. So the mammogram is the main thing. Now, if you're classified as high risk, then we have some other options. If you're a high risk patient, you may be a candidate for a screening breast MRI. And that is a more in-depth look of the breast, much like an MRI of other body parts, but it not only shows us the structure of the breast in many different angles and planes, but it shows us the function of the breast tissue as well, because you get injected with a substance that will light up in areas that are abnormally functioning. So some problems with MRIs, that is very sensitive. So it can pick up some things that can be non-cancerous, but it is a very good screening tool as well, but it's not for everybody. We do have, coming down the pipeline, screening ultrasound, automated ultrasound, to be done by a machine. And that is something that for very dense breasts, young women, could be an option as well, and not as invasive as the breast MRI, but that hasn't made it directly into the protocol yet. I do see some women, try to, kick in all of these other ancillary things like thermograms and some other non-FDA approved that do not have the longevity as a mammogram. We're not comparing, an apple to an apple here. So I would just caution women to not replace their mammogram with something that they think has, is better.
Thank you so very much. Dr. Eugene, what is your advice for patients who have concerns or are feeling overwhelmed regarding treatment?
So from what I've seen in my few years of practice, this experience is overwhelming. You are going to your surgical oncologist, your medical oncologist, your radiation oncologist. Then every now and then I'll see you and I'll talk to you about your medications if there's something that's going to change. And then you have different nursing and different staff members that is there to help you. So I always tell my patients, speak up for yourself. If you're feeling confused, definitely verbalize how you feel and what's going on. And if you have any barriers, definitely speak up for yourself. I find that my cancer patients in general, they don't want to be a bother to people. And when I say in general, I mean every cancer. I have no idea why. And to me, I'm like, you need to tell me everything, what's going on and how we can help. I know for a fact, specifically with breast cancer, you have the navigators, right? That's been scientifically looked at, and it helps. It helps everyone understand the process. So I always tell my patients, if you need someone to repeat something, let them know. If you need, again, more visits in terms of something is not happy, something isn't right, if you're having side effects from your chemotherapy, definitely inform someone about this. So I think overall, to answer your question, speak up for yourself. We can always repeat this information.
Thank you so very much. And I'm so glad you mentioned navigation. I think it's so important to have patient navigators there that also important part of the medical team, I believe. And in some instances, patients are more comfortable talking to them. And it's not that they're replacing any of the providers at all, the doctors and nurse practitioners and those, but I think it's a very much so a strong component in the treatment plan. Dr. Bowie, due to the pandemic, many of us postponed mammograms or yearly doctor visits. Why is it important to start going to the doctor again for routine checkups?
But first and foremost, COVID is here to stay. It's not going
Yes.
anywhere. We have vaccinations now, and pretty much all of us have probably already had it. Can we get it again? Absolutely, but it's not the crisis like it was in 2019, 2020. So I highly encourage ladies, men, to get to their doctors for their routine exams, their routine checkups. It's so easy to try to, because who wants to go to the doctor? And if we have a good excuse as to why we don't need to go to the doctor, in our minds, we think it's okay.
Yes.
But it's so important to get back to taking care of one's health, from healthy eating, exercise, alcohol in moderation, not smoking. Those are things I talk to every one of my patients about. And get back to our routine screenings, whether it's colonoscopy, whether it is a mammogram. Ladies, you need to get back to your yearly mammograms if you're not doing them. And as Dr. McKinney said earlier, it is still the best screening tool for the early detection of breast cancer. Yes, we can use MRIs and ultrasounds as supplements, especially in our high-risk patients, but a mammogram is still the breast screening tool for the early diagnosis of breast cancer. Just to make a comment about thermograms, because we hear a lot about those. My first thing I tell my ladies are thermograms are not FDA approved.
Right.
They're not FDA approved for a reason. They have time and time again have been shown to miss too many cancers. Now, that being said, I would rather her do a thermogram than nothing at all. But still, that mammogram is still the best screening tool. And I highly encourage every woman that is listening to this if you tell all the women if you love that woman, make sure they're having their yearly mammogram.
Thank you so very much for that comment. And I totally agree with you. I'll say that right before COVID, I was supposed to get my first colonoscopy because, the age and everything changed and COVID happened. So I just got it a couple of weeks ago. I was so nervous. I don't know why, but I was very nervous. I was so happy that they told me I was going to be put to sleep, but nonetheless, I totally agree with you. Screenings are important. And so, Ms. Cox, you've talked about some of these resources. What are some other resources that you are aware of across the state related to breast cancer? I think you said you all have 11 clinics that you mentioned, and please correct me if clinic is not the correct word, but what are some other resources? And besides LSU and the program, are you working with other clinical providers, hospitals, health centers, like community health centers? I'll put a plug in, federally qualified health centers. Are you working with other providers, and what are some of those resources?
Yes, so of course we use our FQHCs, definitely. LPCH was one of the ones that we partnered with for many years. In New Orleans, we have St. Thomas Community Health Center. Then we have Noella, which is in New Orleans East, and Dr. Bowie, the women's fan, attends, I think they go monthly to Noella, and that has been a huge success. So thank you guys for that mammography van going out there. And then we also have, of course, our great partnership with UMC, which is our largest contributor and our largest screening site. And throughout Louisiana, we're in 8 different parishes, and we have 11 FQHCs that we partner with, and everything is on our website because I can't remember them all by name. I apologize for that, but they're easily found on our website, which is www.lbchp.org, and it lists even the navigators' names, their phone numbers. So I encourage anyone who's watching, if you want to get some more information about exactly where we're located, visit that website. It has a wide range of information.
Thank you.
Listed there. You're welcome.
Dr. McKinney, before I ask everyone this last question, I think this one is important to respond to. Should people with breast cancer get vaccinated against various diseases?
You can still get vaccinated. We, currently are not restricting patients who are getting treatment even during treatment on getting their vaccinations. Flu, currently is the vaccination, and then updated COVID vaccine. So you can still get those even throughout treatment. There was an issue, before with getting vaccinated, and then lymph nodes kind of swelling up under the arm. So a lot of our imagers were asking the question as to whether you recently got vaccinated, and then making a note of that just in case they saw some enlarged lymph nodes to follow up on and make sure that everything went back to normal. If you're going through treatment, there always is, as with breast cancer, a side that should be avoided. So if you have to get a vaccination, try and use the side that your cancer is not on in order to get the vaccination.
Thank you so very much. I always remember the right side is you can't touch. So as we close, I am going to pose this question to each of you. What is one thing you want our audience to take away from this webinar? Dr. Bowie.
I think the most important thing that we can take away from this is the importance of risk reduction measures. And I think a few of us have alluded to those earlier, and that is healthy choices on our eating, more lean meats, more green leafy vegetables, more fresh fruits. Learn what a good, nutritious diet is. This is not a diet to lose weight. This is a diet to maintain a healthy lifestyle. The absolute importance of routine exercise. And I have to clarify with my patients, this is not activities of daily living. This is setting aside that 30 to 45 minutes a day where you're there to get that heart rate up, whether it be walking, running, jogging, jumping jacks, in your house, outside of your house, in your gym, wherever you want to do this, some form of exercise 4 to 5 days a week. Alcohol in moderation. Most people do not understand that alcohol increases their risk for cancer. It absolutely does. My rule of thumb is 3 glasses or less a week. The American Cancer Society went as far in 2020 to say their recommendation on alcohol is none. That's a bold statement. I say 3 glasses or less a week. And then, of course, obviously no smoking. So healthy diet, exercise, alcohol in moderation, no smoking. These are preventative measures to not only decrease your risk for breast cancer, it decreases your risk for other cancers, heart disease, diabetes, and stroke.
Thank you so very much. Dr. McKinney.
I think the most important thing for me is, one of the things Dr. Bowie was talking about is the self-breast exam, because I find that women feel like they're intimidated and don't think they know what they're feeling. But, you're being flooded this month with so much breast cancer awareness information, but breast cancer, awareness should be every month, because you should be doing that exam every month. And I promise the more you do it, the more you'll know if there is a change. And if you come to, my office or Dr. Bowie's office saying, hey, I feel this and something, it was not there last month, I mean, I guarantee our eyebrows are going to go up, and we're going to, certainly do all of the things in order to make sure that everything's okay. So please don't discount the importance of the self-breast exam.
Thank you. Ms. Cox?
For me, the biggest thing I like to tell the women I encounter is to listen to our bodies. They speak to us. So I drive that message just as much as I drive the importance of breast screening, because it can not just in regards to breast cancer or cervical cancer screening, listen to our bodies for any ailments, and to be proactive, not reactive, be proactive in our efforts. And of course, definitely, I always like to challenge the women that I speak with to encourage family members, men and women. I know we tend to leave the men out, but encourage them, not just during October, but to drive the message forward religiously. This is a serious disease that we can fight it if it's found early enough, as we've echoed, numerous times this evening. But I encourage that I challenge women to at least bring a few of your girlfriends to be screened and talk about breast cancer, talk about those uncomfortable conversations that, that we sometimes neglect to have with each other. So that's my biggest thing that I would like for women to take away from today.
Thank you. And Dr. Eugene.
I think something that all women tend to do, we are the caregivers for everyone, of course, right? So our children, our parents, sometimes our siblings and whatnot. But I think it's time for us to say, put our health in the forefront and put what we need also, instead of putting it always on the back burner. I think, like we all mentioned, you're normal, any changes. So not only being your advocate, but also taking the initiative and saying, it's time for me to get these different screenings. We've been putting it off for so long now. Corona has been here, it's not going. It's time to, get our screenings and get scheduled for those things as well.
Thank you so very much. It has been my pleasure, ladies. Totally. And I love the fact that I now have 4 additional resources that when we're referring patients at any of our clinics, but also for myself, if I have a question, I like the fact that I now have those resources. So thank you very much. It's been a pleasure.
Thank you so much.
Thank you.
Oh, wonderful. Thank you all so much for that wonderful panel discussion. Let me just get everything back up here on the screen for our audience. All right. So yes. All right. Thank you, Ms. Davis. Thank you, Dr. McKinney. Thank you, Dr. Bowie. Thank you, Ms. Cox, and thank you, Dr. Eugene, for your responses and for being a part of this especially important panel discussion. As community gatekeepers and medical providers participating in this discussion, each of you has helped to enrich people, populations, and communities' awareness, and you've possibly empowered others' readiness as well. Thank you so much. All right, everyone. So we'll go over these key takeaways once more. So as is mentioned before, breast cancer is the most commonly diagnosed cancer among American women. However, this form of cancer can affect men as well, as we discussed today. Getting up-to-date and accurate information from credible sources related to breast cancer is important as well, from places like the Louisiana Department of Health, the CDC, and the American Cancer Society. Prevention efforts involve understanding what breast cancer is, the factors associated with increased risk, and the various screening and treatment options available to you, as mentioned also during our panel discussion. And last but not least, early detection saves lives. So I want to also thank all of our attendees for coming and listening to this discussion today. I hope that you found something enriching and valuable that you can take back and add to your discussions with your families and within your communities. Please utilize the resources that we will be emailing to you after today's presentation. You are encouraged to complete our webinar participation survey as well, which I'll be adding to the chat shortly. So you can provide feedback to us for future BCPHE events. Once more, for those of you who may have Medicaid insurance, if your medical insurance coverage is from Medicaid, then you must make sure that your information is up to date. This includes your address. If you do not update your information, you may miss important letters from Medicaid, and you could lose your health insurance coverage. To update your information, you can visit the self-service portal at www.ldh.la.gov/MyMedicaid, or you can call 1-888-342-6207. We'll be sure to send you all the information guide, as well as share the survey link with you in the chat and by email as well. And at this time, I will bring in the Director of the Bureau of Community Partnerships and Health Equity to close out our webinar. Devondra.
Thank you so much, Iana, and thank you again to each one of our panelists. We so appreciate you I hope each one of the participants today will take this challenge on and go protect your pumpkins by receiving a mammogram this month. I received mine last week and I was so excited and ecstatic. Even the little pain that it caused, it was very minimal. It's just really good to know that we're doing something good for our bodies and good for prevention and for our health. So with that, I'd like to thank the staff of the Bureau of Community Partnerships and Health Equity. I have a wonderful team. And of course, the Bureau of Media and Communications for executing such a needed conversation. A huge thanks goes to the entire team at the Louisiana Department of Health. And last but certainly not least, I'd like to give a special thank you to our Secretary of the Department of Health, Dr. Courtney Ann Phillips, for her continued leadership in pursuing a healthier Louisiana. Please join us for our next conversation focusing on American Diabetes Month on November 30th at 5 p.m. That will be our last Candid conversation for 2022. So we please hope that you join us. You can use the QR code on the screen or go to https://tinyurl.com/LDH Diabetes Web to register for our next webinar. This concludes our services and event for tonight. Everyone have a good night. Thank you so much for coming.